Hi, I'm Dr. Shannon Johnson, and today we are going to be using MaxAlign, we like to call him Max, the virtual assistant, to help us in the records gathering process on our patient Vanessa. We're going to use this information to help mount our models in the lab. We're going to start by opening the app. We're going to start by opening the Max app. Next, we're going to enter new patient information for Vanessa, but we're going to do this in a HIPAA-compliant format. We're going to click OK, and immediately you'll notice our outline of the facial skeleton, 2 eye circles to aid in placement, 2 horizontal lines to make sure we're parallel to Vanessa, and in the center we have a vertical line to help Max make sure we can align her to her facial midline. So our next step is to position Max along with Vanessa. We want to make sure that Max is going to be parallel to Vanessa, so patient positioning is very key. She needs to be relaxed and looking straight ahead like she was looking into a mirror. The other thing I've taught Vanessa how to do is to use her retractors, so that way she will be able to place them without me having to touch her mouth. One other key point that we find is if you have a taller table or countertop with an adjustable chair, it gives you a little bit more freedom to adjust the patient and Max together. So, Vanessa, retractor time. As we start to position the patient, what we're looking for is we want to make sure that we're going to get our vertical line in the middle of the mouth, and then we're going to find our position and distance from the patient using the eye circles. So as you'll see, I'll start to slide out, keeping that midline in place. And now you'll notice that we are parallel with the eyes, we're parallel with the occlusal plane using the horizontal lines, and the vertical line is straight on the midline. So we're going to go ahead and capture that photo by clicking on the arm auto capture. It'll count down. Patient's going to stay still, and voila. To recap, so that Max can get the best image, we want to make sure that Vanessa is sitting and facing forward, her head parallel like she's looking in the mirror, and we want to make sure that we're 8 to 12 inches, and please notice that the tablet and the patient are parallel. Those are your keys for success. So the final 2 pieces of information that we need from our patient so that Max can do his job is, first, we're going to need to measure the central, the width of the central incisor, which in Vanessa's case is 9 millimeters. And then we need to find the first point of contact. So go ahead and put your chin up for a second. Separate those teeth. Let everything hang nice and loose. Tension, tenderness, tension or tenderness, tension or tenderness. Go ahead and lightly close till your teeth first touch. And point for me. Correct. Joe. There we have our first point of contact. The next step is to transfer Vanessa's information to Max. You'll notice that in this view we see a stronger part of the skeletal view. We're going to come down and we're going to click and change her tooth size to 9 millimeters as we had measured clinically in the mouth. Now what you'll start to notice is that those teeth change size, but we're just seeing a skeletal base. Right now we want to go ahead and bring in Vanessa's photo so we can compare. You can bring in lots of photo or less. We normally recommend about half and half so you can see both. I'll do just a tiny bit more. Now, this point, the eye circles, we no longer need to be concerned about them. It's all about the centrals. Our goal is to align Vanessa's photos within the measured 9 millimeter centrals. So the way that we're going to do that is we're going to zoom in and out on a macro level to start aligning those teeth. All about the centrals. And now as we get close, and we have a little fine-tuning to do, I want to bring your attention to the bottom right. You're going to see a plus and a minus. The plus and minus will make the width wider or smaller, and then we can use the arrow keys to fine-tune, move around the T. Again, the critical portion of this part is making sure that the centrals are lined up. And that they're flat on that horizontal bar. I can get there. Boom. And you can verify that by going back to her photo and coming back. We're going to click OK. Second piece of information that we want to enter into Max is first point of contact, which was her right bias. And then we're going to click Save. And we're going to get ready to take this and mount. So that's it for Max in the dental office. The next step is to send this information to the lab via email. You're also going to want to include to the lab or the person doing the mounting your high quality impressions or your nice diagnostic models, as well as your bite records. Another key tip is to make sure that you email a copy of this information for yourself so you have that in your dental record at the office. And that's all. Easy as pie.
Hi, I'm Jason, and today we're going to use Max to mount the maxillary model of Vanessa using her photo. Before we start, we need to ensure that the tablet is correctly calibrated. You can ensure the calibration by checking for the green border on both sides. One of the unique features of Max is the ability to look at your patient's photo and also look at a live preview of the mounting stand. Our next step will place the model on the mounting stand, aligning the horizontal line with the centrals. The goal of this step is to align the teeth on the model with a picture of Vanessa. And we utilize the blue capture bar to compare the two images. It's easiest to move the blue capture bar midway, and then using the mounting stand's 20 degrees of motion, work to align the images. As you can see here, we're not quite aligned. And when you think you're in alignment, it's time to use the tablet's 8 megapixel rear camera with flash to confirm. Now we have a photo we can compare with a photo. And to check the alignment, you can get really close into that image and confirm. Now that we have the image that we want to confirm we have the appropriate mounting plate, and we're going to mount the model. After about 10 minutes, you can remove the model, clean it up a bit, and then place it in the working articulator. Then you mount the lower model, go back to Max, check for the first point of contact, and confirm that with the mounted models. I think you will really appreciate Max and the value it brings to your lab. Thank you.